Well, some health officials are warning of a possible tripledemic that could unfold this winter. We're talking about cases of COVID, flu, RSV. They're all expected to rise. Flu cases, in fact, are already higher now than usual for this time of year. So we're drilling down. We want to make sure you're healthy. Joining me now is Dr. Dean Winslow, infectious disease specialist at Stanford Health Care. All right, so doctor, first of all, welcome. We're so glad you're joining us. You're putting some things on my to-do list this week because we know the season is already off to a rough start. So what are you most concerned about?
Yeah, so, again, as you outlined, in your introduction, that we really are seeing, a pretty dramatic increase in other respiratory viruses, particularly flu, which is starting earlier than it usually does during seasonal flu seasons, and also respiratory syncytial virus, which is, causing hospitalization of particularly young children, who are susceptible to a condition called bronchiolitis. So, again, they're impacted as well.
And we're today where kids are out and about for Halloween and they're exposed to who knows what. So let's start there. Let's talk about RSV. It's a respiratory illness that attacks children. As a dad, this is something that makes me so concerned, especially this time of year. Tell us more about it. And for moms and dads and families who have little ones in their lives, especially kids who are out trick-or-treating today, maybe in the next few days, what are the symptoms to look for?
Yeah, so again, in older children and adults, RSV generally causes fairly mild symptoms, more of an upper respiratory infection or cold-like symptoms. So its greatest threat is with very small children, babies and neonates, and also at the other extreme of life, adults who are immunocompromised. Like when I was the medical director of the HIV clinic at our county hospital, I saw a number of patients with advanced HIV who got real sick from RSV. One of the things, though, I would like to reassure parents, though, about trick-or-treating is certainly staying outside and trick-or-treating is really very safe. So I don't want to be, like the Grinch and steal Halloween joy from children. I think that's a relatively safe activity tonight.
Right. So let's get back to this talk of a potential tripledemic. What is a tripledemic and what should we do to try to avoid such a thing?
Again, this is the first year I've heard that expression, but I think it's fairly accurate. So we are still in the midst of the COVID-19 pandemic, and cases, particularly of the various Omicron subvariants, are increasing pretty dramatically. I think the good news is that the COVID-19 vaccine does a really good job about protecting people against serious illness, hospitalization, and death. So, strongly encourage folks to get their COVID-19 booster shot. And secondly, flu is many years a big risk. I think the last time that we had perhaps this large number of cases was in 2009 during the H1N1 pandemic. And similarly, with flu, individuals, particularly older folks, people who are immunocompromised, and also pregnant women, are very susceptible to getting, very severe illness from flu. So really highly encourage everyone to get their flu shot as well.
All right. It's just a matter of putting it down in the day planner, making the call, or logging on and getting it all scheduled. It can be that easy. Doctor, thank you so much. Dr. Dean Winslow with Stanford Health Care. We thank you so much. Stay healthy yourself. We appreciate you, one of the helpers in our community.